If you type in Christian Eriksen's name into Google, one of the first autofills that comes up is heart attack. Christian Eriksen has never had a heart attack. However, in June 2021, during a football match, he did collapse, and that was due to a cardiac arrest, not a heart attack. I explained the difference in the previous video that I did describing what happened to Tom Lockyer when he collapsed on the football pitch as well. So when someone has a cardiac arrest, it means their heart is not pumping blood around the body as it normally does, either because it's stopped or it's in a rhythm that doesn't support life. And a couple of those rhythms are called shockable rhythms. And it very much sounds like in Eriksen's case, he was in a shockable rhythm. He was out for 3 to 4 minutes, and in that time they were doing CPR and also using a defibrillator. In his case, they used it once on him, so they shocked the heart once to bring it back into a normal rhythm. And the way that is done is that you put 2 pads on someone's chest, across the chest or front to back, and you're passing a lot of electrical energy through their chest and through their heart as well, essentially shocking it back into a normal rhythm. It's not really like the movies where they've got the 2 pads, are rubbing them together and jumping people. And whenever you deliver a shock like that to someone, you have to make sure no one is touching them because they're gonna get zapped as well. And thankfully in his case it worked. You know, the CPR was started early, the defibrillator was used early, and apparently someone said he was 30 years old and he immediately corrected them that he was actually 29 at the time, so he was not confused at all. They did fit him with an ICD, an implantable cardioverter, which will sense if his heart tries to go back into these abnormal rhythms that cannot sustain life and can cause another cardiac arrest. But before that happens, this ICD will shock the heart back into a normal rhythm. So since then he's been playing, he's been otherwise fine. However, in some leagues, once you have an ICD, you can't play in certain leagues, so you probably have to change teams, for example. In this case, there's no information out there as to why he had a cardiac arrest. What I'll do in the next video is talk about Fabrice Muamba, because we know why in his case he had a cardiac arrest.